Welcome back to Morning Express. It is now 28 minutes after 6. Time for us to have our dawn debate. And this morning we'd like to look at the withdrawal of funds that was, given by the U.S. government previously, up to 2 billion shillings that was coming to the Ministry of Health. And to have that conversation with me, we've got Dr. Gladwell Tungo, who I'm going to be talking to in just a short while, just to look at what that means, what is it likely to affect, and how we'll move on as a country, and also the causes of withdrawal for this particular amount of money. But before we have that conversation, let's just run through some of the areas and the sectors that are going to be affected by this particular withdrawal of 2.1 billion from the Ministry of Health funding. Number one is salaries and wages of all staff under global health security agenda. So that is going to be affected directly because their money was coming from the 2.1 billion Kenyan shillings. We also have salaries and wages of all staff under U.S. President's emergency plan for AIDS relief. So, of course, that is a big one as well, because we do know that HIV and AIDS has been one that has been controlled or brought under control to some extent because of that funding. Domestic and international travel for meetings, training, and conferences. This, of course, are key because that's where I would say that capacity is built within the Ministry of Health with health workers getting training and giving training and getting supply of that. So conferences are going to be affected. Supply of ARV drugs to about 250,000 Kenyans. Again, we see HIV and AIDS there being touched in terms of ARVs. And just to mention, I think I was listening and I heard that apparently, according to a new survey that's being done, ARVs are literally contributing to the quality of life of people living with AIDS to a point where they are living almost a normal life, to the lifespan as though you did not have HIV and AIDS. So, of course, 250,000 Kenyans affected because of withdrawal of that 2.1 billion Kenyan shillings, a huge number right there. Printing and dissemination of communication messages. Again, this is to do with communication and getting information out there to those who may require it. So that's going to be affected. Management and operations at Ministry of Health. Of course, we'll be looking at some of the details that are possibly going to be affected with management and operations at the Ministry of Health. Now, just to give you a scope and a reason as to why the U.S. government say they have withdrawn that 2.1 billion Kenyan shillings, they say that there was weak accounting systems and allegations of corruption, which of course many Kenyans will be left thinking, well, not another scandal. Now, let me move in and join Dr. Gladwell Tungo, who is a doctor, but also a doctor who's now thrown in the hat into politics, and you are seeking the woman rep for Baringo County.
Yes.
Good morning, and thank you for joining us this morning. First of all, why change from medicine and, treating people to taking care of people's needs as a politician?
Yeah, I want to say it's a service at the same time. For a very long time, through the Ministry of Health, I've been serving this country on the service of providing health care and giving medicines specifically. But at the moment, I've turned my wish and will to help the Kenyans on the other part of going for politics because of legislation and to give them better services in policy making.
All right, let's now just concentrate on the matters at hand here. 2.1 billion shillings, which of course is a lot of money, which the U.S. government has withdrawn, and their reason is because they say there are weak accounting systems and also the fact that there's allegations of corruption. First of all, your thoughts on that and possibly what that means, because we are looking at a huge figure, but you have worked in the industry. What does that mean to the Ministry of Health?
It's a serious hit on us as a Ministry of Health. For sure, the withdrawal means a lot. It means we shall lose some services in terms of losing staff who have been paid through a global fund. We will lose medicines, particularly the HIV drugs, which actually has been giving a lot of help and quality life to Kenyans, especially living with HIV. The loss of this would mean a lot of negative health results in this country, particularly when we talk of 250,000 people.
250,000.
250,000 who are on ARVs, and we are saying they are not going to get ARVs for free as they have been getting. Looking at the price of ARVs, it's not affordable. Even for a middle-class person, I can tell you it's not anything you can sustain. And for sure, when we're taking ARVs, it's a drug that is a lifetime drug. You have to take it like twice every day. And when you look at what it will come with.
And referring to the survey that I was talking about there, apparently ARVs currently are help to many people living with AIDS, and this is because they give them the quality of life almost to back to normal.
Yes.
Is that accurate?
Actually, yeah, it is true, because when somebody takes ARVs, the virus goes a bit dormant. The person comes back to health, the CD4 count, as in the immunity, comes up, and you may not be able even to realize that this person is having the virus. And the person will be able to continue with their day-to-day duties, provide to the family, and do the activities as required.
Okay.
But now, with this,
having worked in the health sector, where did Kenyan government go wrong for the US government to come out and crack the whip in form of removing this 2.1 billion Kenyan shillings?
Yeah, I've worked with Ministry of Health for quite some time. Particularly in that department of dispensing ARVs. I've been one of the people who's been dispensing ARVs in Kitale District Hospital for some years. The activity is going on also in many parts of the country. And what I can say is that I've not worked in the mainstream where decisions are made, as in how money is being accounted for, how it is being maybe given to Kenyans, how the services are given. But as we've been in the reception, in the receiving end, we've been only implementing what has been arranged by Minister of Health. But I can't know exactly what happened there. But of course, the allegation that there is misappropriation is yet to be confirmed.
Okay, so where do you think we went wrong? I mean, for the US government to get to a point where they feel they have to withdraw the money, and one of the reasons being given weak accounting systems. From your experience, since I'm sure you interact with the Ministry of Health as a health provider or worker, or that's the service that you're in, where have we gone wrong as a country?
I want to believe, basically, it might not be corruption as such, but misappropriation, the word they are calling maybe poor accountability, or maybe putting right money in the wrong places, then it amounts to poor accountability, which maybe the US government designed for specific activities, then maybe in the process, they were used in other activities. Now, when coming to account for, it looks like money actually was stolen or such.
All right.
Yeah.
Now, the other area that has been mentioned that is going to be affected is domestic and international travel for meetings, training, and conferences. How important are these meetings and conferences that health workers go for, basically just to keep themselves updated with what is happening in the health sector worldwide?
They are quite important because we go for maybe comparisons of services, new updates on new trends of diseases, and how management should be updated. You know, now we cannot sit back here and think we are working towards everything becoming okay within ourselves when we don't have comparisons. People go for international meetings to meet with each other, to meet with other health providers elsewhere, so that they can compare notes and get to know what are the new trends of diseases. Yeah.
So you feel this would be an area that is important and affected grossly by the fact that now that money has been withdrawn?
Of course, yes, it is important, although not as important as the withdrawal of medicine. The priority here, if Kenyans can get medicine, we can postpone even the travel. But then it doesn't mean that it isn't important. But all of them work together to give the better services that we need for Kenyans.
Okay,
Yeah.
let's look at the devolved system, because you are going for women rep in Baringo County.
Yes.
How is the health sector in Baringo County so far, from your observation?
Yeah, I would say in Baringo County, we aren't saying we are satisfied yet with health sector, but then with the devolution, we are saying at least services are nearer to the people in terms of even the staff are getting to be handled their issues within. They don't actually, like they're staying in an amorphous world. But then devolution generally, if I was given to decide for Kenyans, health would have not been devolved if it is me.
You'd rather it was not devolved?
It's rather
Why?
it was not.
Why is that?
Yeah, because there are a lot of issues that come around with it. You know, at first, I want to believe Kenyans or leaders thought devolution of healthcare, which is a primary docket in this country, like security, education, they thought it is anything easy to handle. I want to believe it would be one of the things that's bringing about this inaccountability. But then that is late. Let's say we need to work more. We need to...
But when we think about it, devolution was meant to bring the services closer to the people.
Yes.
And by that, even on the health sector, when the money is given to the county government,
Yes.
it is closer to the people. They're able to decide as a local government what is important for us and what is the priority, as opposed to a national government who has to oversee all this. Wouldn't that be an advantage, having it closer to the people?
Yeah, it would be an advantage, but the problem is this. I wish it was done in a piloting manner. The management of health sector, it's a huge thing. It's not anything that people think it is easy to handle. And the other thing, when you look at our boundaries and devolution of health, when we have outbreaks of diseases, it is not easy to control. The disease doesn't know which county is this, the other one, or the rest. And then for these counties to interjoin and do things together to fight the same problem, it becomes an issue. Actually, I agree. The services, as much as we are claiming that it would have been brought nearer to the people, I want to attest to you also that these services have ever been there. It's not that they are now more closer than before, because if anything, there are no new infrastructure which have been constructed. So what are we saying? We ought to have done maybe piloting of some facilities. We see how county government is able to manage. But again, in some areas, some counties have managed it well. They have been able to feel the difference. A county like Turkana, for that matter, I visited there one time. I realized they have more drugs than before. But again, there are so many hitches, even in issues of staff. You realize even now and then we have different hitches here and there about strikes. People are not satisfied. They think there's no promotion. They don't know which way forward. And all this affects the services to the people.
All right. Now, you're coming from the health sector and going into politics. And as woman rep, you would be expected to represent your people, even in regards to health. Now that you have the experience, what is it that you will bring on board that the people of Baringo can say, okay, in terms of our health, it is going to improve because we have Gladwell Tungo?
Pleasure. In fact, that's a point I'm going to ride on very seriously. There's two specific areas I've already identified. For sure, when we go to our lower parts of the country, or our county, Baringo for that matter, that Baringo County, I can tell you that some parts of Baringo, we can have people who have never even been dewormed since they were born. They have never been even nearer to any private sector facility or even visited a health facility there. The know-how of the importance of deworming is not even with the people, as opposed to the current way of people doing leadership, where they only think of water, infrastructure, roads, and electricity. But who thinks about the health of the person? You know, we need a healthy nation so as for us to develop. That is one part I'm saying, if God gives me a chance, I will actually work
How will you get that done? Because I'm sure we've had other people who've come out and said, yes, this needs to be done, but how are you going to, how is Gladwell going to make sure that
Gladwell is going to do it like this. I can, what I'm going to do is this. Now being a pharmacist, and of course, working with pharmaceutical companies and friends, and across the board I have pharmacy friends, access to medicine. I can go, I can pursue some donation, and even purchase for that matter.
Donations from where?
Partnership of these companies I'm talking about, pharmaceutical companies. We can talk of how they can help me to give that service to the people of Baringo, particularly in schools. Because you see, when we go to schools, you realize the children, almost all of them, have ringworms. They look not healthy. When you look at it all, it is about deworming. It's about the worms. That is one part that I think it's workable. Throughout the time that I'll be working. But
don't you feel, Gladwell, that would be you as an individual bringing in players, if at all they're going to buy into your idea, and then it becomes, it doesn't help the county to move forward when you're not there. It becomes tied to you.
No. Actually, I cannot take it as our own project. I can entrench this thing into the Ministry of Health system of the county. We can decide, but I can front it. It's an idea that I have. It's an idea that could be new to them, but can make them know that it is possible. We can create how this thing can be sustainable. It's not an expensive activity, exercise.
Okay.
The other bit is about lifestyle diseases. For sure, for a very long time in Africa, or even, let me talk about Baringo particularly, people do not know, actually. If you ask them, like today, how many people even have took their high blood pressure yesterday to know how their heart is performing, you realize quite a minimal number of people know about it. And it's only those people who are situated in maybe towns. The rest of the people who are living in our rural areas actually do not know their status. They don't know their blood pressure at a given moment, even for a whole year. Even for the blood sugar, people do not know.
How will you improve that? Because maybe the reason they don't do that is because the facilities are lacking. Maybe there's not enough facilities for them to do that.
Yes.
So how will you make a difference in Baringo?
That one, I can tell you, it's possible. We can achieve. It's something that's workable. We can actually, again, through the Ministry of Health, go and look for partnership, like I said. India being one of the places which supplies Kenya mostly with variety of goodies, including diagnostic
and even medicines. Although you'll find that medicine in India is maybe a quarter of the price we pay here, how can you change that so that we can also have cheaper medicine?
Actually, as a person, it might be not very easy.
But you are going into an office of
Yes, yes.
If you do make it to women rep.
Yeah, you know, the problem that we have generally in this country, we are used to more importing than producing. That's something I've realized in everything.
And that is the problem, but how would you bridge that gap? How would you solve that problem?
It is through this pharmaceutical department. It is through our department as pharmacy to look into the legislature to make it possible to ease the burden of creating industries for production of medicine for the people, because we have the capability. We have the human resource. We have a lot of pharmacists around, but for a very long time, when people compare producing products here vis-a-vis importing, it becomes cheaper importing. So it is also in our country where we need to start realizing that we need to look into the burden of taxes so that people are able to produce products here. Vis-a-vis taking raw materials from Kenya to another country, then they are processed and then brought back. I mean, it is high time we look for a way of embracing industrialization in this country, which in turn will also increase job opportunities.
All right. There's a looming doctor strike, and there are some doctors, I think, in Machakos who have threatened to go on strike. And this is because they say that the CBA that had been agreed upon with the government has not been implemented. Your thoughts on that? And possibly, is it going to affect us again?
Yeah, if they are going to go on strike again, of course, the impact will be there. We will feel it. It will,
Do they have a good reason to go on strike?
Of course, you know, people cannot start walking on the street just for no good reason. If actually the CBA was not respected, then you expect that they feel that their issues are not met. Mm-hmm. So they should be having a reason of going back to streets. Mm-hmm. But then if things were to be worked on well, it would be important not to allow them go back to the streets. Mm-hmm. The CBA should be looked at and respected. Let them be given what they agreed. And maybe possibly in future, Ministry of Health should be looked at maybe as an isolated department so that we can, like education, if it is possible, give it a commission so that its particular issues are handled within that commission, mm-hmm. other than actually heaping them with the rest of the civil service ministries.
Mm-hmm. Why do you think the Ministry of Health should be separate? What?
I feel like it should. Actually, I call it special, maybe because I come from there. But then the services they give are so essential, so essential, especially when we talk of people's lives, other than others.
But one might argue that all the services given are essential. Yes, the Ministry of Health definitely has a critical role, yes. Because for many it is really a matter of life and death. Yeah. But how would that improve its operations just by isolating it or giving it a commission?
To me, if it is isolated and given a special commission for themselves, they are able to handle the things within. So that, you know, at the moment when Ministry of Health or the staffing or the human resource there go to argue about their issues, about increment of salary, I've been there agitating for their rights. The whole story comes like this. If we handle you like this and that, what happens with the rest, you know? Mm. So if there is a way we can be isolated so that in this special department, I'm not saying the rest are not, but of course, we are talking about it is between life and death. Mm-hmm. So if we can be isolated, mm-hmm. so that our matters can be handled separately, mm-hmm. so that we are not heaped, so that if it is possible, we are given what they are supposed to give. Mm-hmm. But now, when we are lumped in the whole civil service, becomes a bit difficult. I understand where the government comes from, mm-hmm. because when you add me salary as a doctor, you are not adding a police officer. We are in the same category as civil servants, and not an isolated commission. It becomes difficult. And if teachers have been having their commission, yes, why not doctors? Yeah?
All right. Let's come back to the funding from the U.S. government, which has been withdrawn, the $2.1 billion. As we wind up, what's the way forward? What is it that the government needs to do to realize this funding to come back? And secondly, what are we likely to face if it is not put back?
Yeah, the government of Kenya should look into persuading back this amount of money.
Persuading, but the reason why they are not giving the money is because, one, there is allegations of corruption, and two, weak accounting systems. How do we persuade them to bring back the money? Yeah. Yet we've not solved the problem.
In the process of persuasion, they make sure that the house is in order. They prove that they are able now to manage the coming money well. They should be able to actually look at what went wrong where, who messed where. Then they clean up the system. Mm-hmm. Then from there, go for persuasion, because actually we need. Without this funding, we will realize a lot of damage, mm-hmm. a lot of damage. Mm-hmm. There will be also economic negativity. We will feel a lot of damage, because if the nation is not healthy, then you realize people are not going to work. Mm-hmm. Remember, even as we continue losing this money, there are more new infections coming in. Mm-hmm. These infections which are coming in still will need drugs. They'll have more complicated virus, which is not controlled by medicine. And it will be chaotic, even Minister of Health for real. It will be a very bad situation for us to handle.
All right, and as we wind up, Dr. Gladwell Tungo, you are going to be woman rep if the people of Baringo decide to vote for you. What is it that you're offering the people of Baringo? What is it that if we sit here next year, we can put you to account and say, you promised to do A, B, but you did not, or you did? What is it that, what's your promise to them?
Yeah, my promise to people of Baringo is that after my election, come August, we need to work particularly in the groups that are vulnerable. The youth, the women, and of course, people living with disability, the orphans. The docket of a women rep, of course, is entrenched on those lines. What I want to do for them is that for a very long time, Baringo County has been difficult to bring socio-economic issues into line with even other counties because of the services which have not been given to them well. So what I want to do, especially for women and youth groups, for real, you realize that the government gave us a window that the 30% of tendering in the county should be given to these groups. But at the moment, you realize they are not realizing it because nobody has stood by them to help them on the way of even getting that tender or facilitating them in terms of capital. So as their women rep, I'm going to stand in the gap and bridge it between the county and them so that they can get these chances to take their part, which is 30% of tendering processes.
All right. Thank you very much, Dr. Gladwell Tungo, who is a doctor who has, well, changed profession and throwing your heart into politics. And we wish you all the best. She is throwing her heart in for woman rep in Baringo County. Thank you very much for joining us this morning. And that's where we wind up the Dawn debate this morning. But do stay with us.